Many school districts are asking parents to decide this summer, will you send your kids back to school in the fall so they can plan? To help you make that decision, I'm joined by Dr. Thomas Murray. He is at the Yale New Haven Children's Hospital and a medical director dealing with infectious disease. Thank you so much for being with us.
Thank you. Nice to be here.
So what should you look for in your school's response plan? I know you've said as a parent, you're going to be looking for certain things to know that the school is handling things properly.
Yeah, and I've worked with a couple of different school districts, and I've really been impressed with the thought that has gone into the development of these plans. And so things that I think are really important are to understand social distancing and how that's going to be employed. The other piece of it that's critically important is when it's going to be very difficult for a child to wear a mask, 7 hours straight. So how has the school thought about that, and what are the plans for breaks in masks, and how can that be done safely? And then finally, things like lunch and when you're engaging in activities where a mask is not ideal, like physical activities or eating, what kind of plans has the school put in place, especially with respect to distancing, to allow those activities to occur safely? And then the final thing that I think is important is, given this underlying level of transmission that we're seeing with schools closed, it's inevitable that even a school district who has done everything correctly is likely to see a staff member or student come down with COVID at some point in the fall. So what has the school put in place to deal with that situation when a child or staff member becomes positive, and what are their plans?
And we know that there are going to be COVID cases. You said sometimes that doesn't mean the school district did anything wrong. You also say it may not mean that they have to shut down every time.
Yeah, it really depends on the nature of the exposure. If it's a child who's been in a group with only a small group of other children and has been masked, and everyone around them has been masked, it may only be isolating that group of children for a period of a couple weeks from the school, and that other students who were not anywhere near that part of the school could continue. However, if you start to see widespread cases within a school, then I think it becomes a different situation.
Doctor, I know we have a little bit of time left, but assuming you're in a small study group at school, what about going back to sports and socializing? You might be with different kids then.
Yeah, and that's inevitable in terms of, getting ready, and decisions are going to be made soon, I'm sure, about fall sports. Anything outside is better, for sure, and less risk. And what's going to be important from a school perspective is to just know where that child has been and who they've been with, so that if there's a positive case, they know who has truly been exposed.
Dr. Murray, thank you so much for being with us and helping parents decide.
Thank you.